My name is Tiffany Spraggins-Payne. I'm your host of Zigzag, which highlights women entrepreneurs and industry leaders of the science, technology, transportation, engineering, and mathematics industries. We talk to these women about their business models and how they differ from their competitors. Kyana Brathwaite is the CEO and founder of KB Calls, Caring Advocacy and Liaison Services, which provides healthcare interaction services. In other words, she provides healthcare insurance navigation, wayfinding, helping her clients to understand how to actually utilize their health insurance, make decisions about providers. Above all things, she provides opportunities for her clients to learn how to optimize their healthcare plans and their experiences in the healthcare system. Welcome, Kyana.
Thank you.
You're welcome. So we're going to start off with you telling us about your background. Tell us a little bit about your educational background.
Okay. I've been a registered nurse for well over 12 years. I started in healthcare about 20 years ago at the bottom as a nursing assistant and kind of worked my way through that process, eventually graduating from nursing school here in Philadelphia. It was a hospital-based program. And I did critical care. I moved around in a couple health systems doing postpartum and PACU, and really honed my skills in the sense of having different experiences and seeing our patient populations in different spaces, different areas, and how they interact with and at what point they come into the healthcare system.
That's awesome. You know, I love what you do. I've had an opportunity to read your bio. I've had an opportunity to talk to you offline, and you're doing some amazing work.
Thank you.
And you're welcome. And one of the things I would love for you to do before we move forward is talk about how you have been able to offer bedside manner to your clients.
One thing that I am very aware of is that when you come to the healthcare system or the health insurance system, you're looking for something. You're looking for wellness. You're looking to get rid of discomfort. And my realization of that has allowed me to see beyond your hurt, your pain, your discomfort, your anger, your frustration, and treat you as a person who needs to be respected,
yes,
and talked to, and if there's, and given the opportunity to question. Recognizing that is what has always allowed me to really sit down with my patients, my clients, and hearing their story and understanding how that story impacts their health. And I did that at the bedside, and I do that now with my clients because we are not just what you see in front of you. We are our story, and we're our experience, and that frames the conversation that you have with your healthcare provider. That frames the conversation you have at that entry point when you're going to that system, and how you experience that system. So being aware of that and just, really getting to know who you are, what your worries are, what your concerns are, what you're looking for. That's how I've translated that critical care nurse into what I do at KB Calls.
So KB Calls, Caring Advocacy Liaison Services. What was the impetus for this company that you started?
I noticed that there was a gap in connection, a space where we as people only used it when it was necessary. We avoided it whenever possible because of some experiences we've had, some experiences our family members have talked about, and it's not the most friendly of spaces, So realizing that and connecting those dots for our patients when they would come in for procedures or they would come in for other things and saying, hey, have you talked to this physician or they started a new medication and they thought that it was for blood pressure, but it was really to protect their kidneys, and having a conversation with them about what that really means, what the difference is between those two things, and then informing them to be able to then have a real participative conversation with their provider. I love doing that. And that was the part of it that was like, I love, really connecting those dots for everybody. And so that's where KB Calls was born, is that the gap was there. And I think that we need to move from kind of a knee-jerk reaction in how we interact with healthcare to a more intentional planned out, strategic, participative way of saying this thing is here for me to help me be a better me and to feel better and to be well. And if you look at it from that standpoint, then it's friendlier, you're friendlier to it, and you don't see it as a hostile entity coming at you and that you have negative feelings about.
So with the rise of more healthcare, home healthcare, could you tell us about how your company is a bit niche in the fact that you work alongside of insurance companies, you work alongside of hospital systems? Can you talk to us about that?
I'm more of an impartial person, entity, company that comes in and really says, okay, where are you? Where do you want to be? What is available to you? And how do you best utilize that? And having the impartiality allows me to really help you utilize those resources that you do have available, whether, it's however you receive the insurance or however you're covered. And really, like I said, connecting those
Yes.
dots. And so I like being impartial because it allows me to care for and to really advocate for what the family, the individual, and moving into the business space, what they really are looking for, not just dollars and cents.
So having to navigate HIPAA and different things of that nature, how are you able to do that and still be able to work with the patient, the hospital, and the insurance agencies? How are you able to navigate the paperwork?
It's been interesting I only speak on behalf of my clients when necessary. A lot of the information gathering that I do, I try to keep it confidential because, everybody's pulling in our information and utilizing it. So when necessary, there's waivers that have to be signed and affidavits that I will send to insurance companies and doctors' offices just saying, yes, I am authorized by these individuals or these families or these persons to speak on their behalf. For the most part, the insurance companies and the doctors' offices have been very, friendly and open in communication. But I do know how to speak to them because I've had to do that on the bedside nursing side. And I'm familiar with some of their policies and procedures and how they impact both the provider or the healthcare entity, as well as the individual and the family members. So just maintaining their information in a safe space. I have a server that I put all their information in. It's locked. Nobody can touch it. And then only sending the information as required. So if I'm not required to send it, I don't send it and I don't ask for it to keep their information and everything confidential and safe.
I think that's wonderful. Could you talk to us about how you have built your team? I mean, this is an amazing concept that you've developed. I think being in the space of being a nurse by trade, really understanding your craft inside and out, your occupation. And I use the term craft in the sense for you because you are creative and you have figured out creative solutions to support your clients, still provide them with a level of customer service, customizing their experiences, but then also helping them to navigate these larger monstrosity of health systems and insurance systems. So my question to you is, what does customer service look like from your perspective?
From my perspective, there's always the golden rule to treat others as you want to be treated. And I found that doesn't necessarily work because the way that I want to be treated is very different from the way that you want to be treated. I mean, we do have similarities in wanting to be respected and wanting to be allowed to ask questions and to feel comfortable and secure. But how that's done is very different. So I really take the time to get to know my client. I do ask questions, but I like to let my clients talk because they then start to tell me their story. So for me, customer service is getting to know my client's story and really understanding how I can align with my client, how I fit into their lifestyle. I have some clients who I only talk to via email. And that's the way it works for them because, their lives are busy. And then I have some that I only talk to via text, So it really I like to know how do you want to be talked to? How do you want to be contacted? What are you looking for? Where do you see yourself and where do you want this? Yes, I may be helping you find insurance, but what does that really mean? How do you want to use that?
Yes.
How have you kept your health and your wellness up without having insurance. And let's not just say, oh, let's get you insurance for the sake of getting you insurance. But maybe what you're doing is working and maybe you don't need insurance, So just really, what is it that you really need and what is it that you want? And how do we meld those two things together? And how do I do the best for you to do that and be honest with you? And that's what customer service looks like: honesty, integrity, and caring about the person that I'm caring for.
Would you say at the core of everything that you do, empathy is
paramount?
Okay.
Paramount.
Talk to us about that.
To step back into my nursing space at the bedside, I knew and understood that being in a hospital is an uncomfortable space. You're not in your home, you're in a bed, people have to come in and out, and there's bells, and it's just a really uncomfortable space. But once I became a patient, I had a few visits to the ER for some things, and I had 2 children, and I was in the hospital. The way I treated people didn't shift completely, but it was like, I really get it. You're uncomfortable. Let me step outside the room. Let me knock on your door.
Yes.
Do you need a few minutes to gather yourself? You look upset. Let me step out because you're not in your comfort zone.
Yes.
So me being here, is that okay? Do you need me to be here? Let me get you some tissues. Let me try to anticipate based off of some of my experiences, what I felt. The people who made me feel, yes, I understand this isn't your space, but I'm here to help you. I'm here to care for you. Let me channel those people and do that for you, and tell me what that looks like for you, not what it looks like for me. That's kind of, how I've worked with and how I've learned to empathize, and sometimes saying nothing and giving that person pause to get themselves together, or stepping out while they're dealing with a new diagnosis or, a procedure that they didn't know that they would have to do, or, you just found out that your insurance doesn't cover the CAT scan that you came in to have done, and you've been sitting here for an hour and a half. Let me not push my thoughts, my duties, my task list upon you. Let me give you a moment of pause. So stepping into a room, seeing you, telling you I see you, and then saying, okay, what do you need? That has been, I think, what has really allowed me to be successful with people, because in the end, there is a system, there's healthcare systems, but we as professionals are people, and the people that we serve are people, and remembering that every day when I walk in the door.
So give us a brief overview of the healthcare system. We're here in Philadelphia. So could you just give us a brief snapshot of what does it look like from soup to nuts? A brief overview of how to navigate a healthcare system in Philadelphia, utilizing your services, of course.
Okay. So utilizing my services, that we have a number of healthcare systems, and they all have their strengths. People go to them for different reasons. Some of them make you, even though they're big, they feel like they're still community. And some people like that big teaching institution feel because there are more people available. So to utilize my services. So, for example, if you're leaving one health system and you're going to another health system, let's say UPenn, Mainline, they're very well-known health systems.
Okay.
Your records and everything may not always transfer over. So what I would do for you is to say, okay, if you're leaving UPenn to go to Mainline because you're moving out into the suburbs and it's closer to you, there are certain things that you need to make sure you carry with you, like you have access to your medical records. Make sure that when you're looking for your doctors switching over, because you're going to need to probably switch doctors,
right?
Just so that communication is seamless, and the systems, once you move out from one, the other system has everything. Because as a patient, as a person coming in, when you're not well, you forget things.
Yes.
So kind of walking you through that plan from that transition. Remember your allergies, write that down, have that in the space, because even if you're leaving one and going to the other and they transfer over your records, you may lose some things. So keeping a record of your allergies, keeping a record of, your most recent doctor visits and what was done, what was said, why was it done. Also finding those new providers, because you're comparing apples to kumquats. So
I love that.
There's no way to compare one doctor to another doctor. So sitting with you and saying, what did you like about this provider? What kept you going back to them? And now, okay, there's these providers in this health system and, kind of vetting them a little bit and not just going, well, they're close to my home. Well, maybe you only went to that doctor because they were close to your employer.
Right.
Or you like their office hours, or they were available on Saturdays. So what was it that really kept you going back to them and then looking for those things with other providers and trying to really connect the system and transition as best as you can? So that's one thing that KB Calls would really do, is help you with that transition in those healthcare systems. Because, like I said, healthcare is people are the ones that run the system. So, you still have to do some of that legwork. You
Right.
have to pick up the phone and call your GP or your general practitioner and say, hey, I'm sorry, I'm not, I'm moving. Did your office staff send those records that I asked you to send? Did my labs come through? Can you mail those to me? Because we all get busy. You have to remind people. Unfortunately, in this day and age, you still have to remind people because a good friend said, your fire is not their fire. So you have to remind them of your fire.
Yes.
And do it in a pleasant, respectful way. And try to connect to the people in the office, because the people in the office are the ones who are going to really make that transition. Not the doctor, not the nurse practitioner, but the actual office staff, the office manager and the receptionist, because those are your front end people. So talking them through, connecting to them and what needs to be pulled over, how soon it needs to be pulled over. So that's kind of how I would walk my clients through that process.
So is it fair to say that you're a bridge between the insurance agencies, the hospitals, the doctor's office, and your client?
Yes.
That you are not only providing them with the tangible, services such as, hey, let me help you, said client, let me help you to inventory all the things that you need if you're going to make a transition to another healthcare system. Let me inventory what you had at your previous place, and let's carry that over. But you're having a conversation. You're always at the helm of having open, free-flowing dialogue with your clients. That's what it sounds like.
Yes.
In addition to making sure that the burden of navigating the healthcare system, the insurance system, and then whatever ailments or not they may be dealing with, you try to create psychological space for your clients and offer that professionalism that's needed on their behalf as an intermediary with the hospitals and insurance agencies.
Yes.
I think that's amazing. I would love for you to tell us about some new opportunities you might be pursuing. It could be opportunities that you're looking to pursue within the business, because we know that as you're growing the business, you're also working on the business. And so talk to us about how you were working internally to continue to keep your business flourishing.
One of the things that have come across, have been suggested to me quite a few times, is to not just work from the individual family side, but to also work from the business side, because you have a lot of business owners who are making decisions for their employees and trying to balance what their fiscal needs are with what their employee needs are. So I'm venturing into what we call the B2B space.
Awesome.
And trying to really figure out how to align myself with companies to make sure that their employees and themselves, that they're taken care of. Because a lot of times as a business owner, when you don't understand your health benefits and how to use them, that kind of translates and trickles down. So, and people get afraid to use their health insurance because it wasn't the same as the employer that they had before, and they're not sure what's covered. And to have to juggle understanding HR needs and benefits needs and financial needs and marketing needs. There's so much one's head can hold.
Yes.
And so much attention you can only give to certain things. And still do what you do well. So that's the space that I would like to move in, is to be able to partner with business owners to say, okay, well, if it's not open enrollment for you and you've chosen this plan, I can talk to your employees about how to properly utilize this plan. And I can explain to them some of the benefits to show them that, yes, as an employer, you do care about your employees. And that's one of the reasons why they should stay, is because you do care. Yes. And it's a little more of an intimate feeling. And let's make sure that you're using this and that the money is being spent well.
I love that. I think it's so great that you're transitioning into becoming more specialized in your markets. I think this B2B space is really huge, particularly as the number of entrepreneurs that are growing their businesses, starting businesses there's vast opportunities there. And so I want you to tell us how you have begun to think about how you can solve for those needs, anticipating the needs of those business owners. Just like three tips that you've been thinking about when you think about these business owners that you want to impart to them.
Okay. One common theme that I have really recognized throughout my health professional career is that we all kind of choose insurance the same way. What can I afford?
All right. Talk about that.
So what you can afford sometimes doesn't always gel with what's coming on the back end.
Yes.
So we're looking at the front end. This is what I'm paying monthly. This is what's coming out of my check. This is what I'm seeing. But then when it comes time to go to your general practitioner, you're not thinking about that copay. So now you went from, if you had chosen, let's say that I go bronze, silver, and gold a lot of times with plans because it's very simple to understand.
Yes.
Lower end, higher end. Yes. And let's say you chose the lower end because you're relatively healthy. You haven't really had to use the healthcare system a lot. So you're like, I'm not sure I really need to spend this amount of money. It doesn't really make sense to me. And then something changes, or you do need to go to your general practitioner. And that before, where you had that mid-level or high level and your copay may have been $10 to $25, now your copay is $50.
Okay.
So not only are you paying monthly, but now I may not go see my GP because I'm not in a space where I can afford that copay. Well, it's the same for the business owners. You have this coverage that you're not using.
Yes. Because
you realize that the conversation you had with the broker or the conversation you had with whomever sold you the insurance, it wasn't a whole conversation. The questions were not being answered or asked that showed you the whole picture of how that plan is really going to help you stay well and keep you healthy and not provide you some angst behind using it. So the tips are, look at how much it costs you monthly.
Okay.
But also start asking about deductibles. How high is the deductible? When do we meet the deductible? And the deductible is, there's a certain amount of money you have to pay out of your pocket before the insurance kicks in. And sometimes smaller businesses go for higher deductible plans because it's more affordable. But then you yourself using that plan are paying more out on the front end before the insurance even kicks in for you. So have a conversation about that. Let's talk about copays.
Yes.
That's another tip. Let's have that conversation. What do the copays look like on this plan? What's in network, what's out of network, and how often does that list change for this plan provider? Is it something that's settled? Once a year you all revise it, look at it again. Is it ever changing? Does it change every day? Because myself and my employees need to know about that. And then prescription plans. What is it?
Yes.
What's the average that is covered?
Yes.
Do they cover generics? Do they cover brand names? What brand names? Can you give me some examples of brand names that are covered? So those would be my tips. Look at what it's costing you on the front end, but have a conversation, ask questions about what it's costing you on the back end. What is it costing you when you actually go into that entry point and you start using it? Are urgent cares covered? Can I only go to the emergency room? Is there an allotment for the number of times that myself and my employees can go to the emergency room? So those are, and those are really, when you start thinking about how you use it, how often do you use it? What are you using it for? What do you need it to provide for you?
Yes.
Then that'll start jogging those questions of, okay, this is how I use it. And come to your broker or come to, KB calls and say, hey, this is how I use it.
Yes.
Now let's talk about, this is what I can afford. Let's talk about plans now.
What excites you the most about working alongside of entrepreneurs, just as yourself?
We are creative and we find ways and we make ways out of no way. And, we're always on the go. We always have so many different things on our mind, and we are not only doing this for ourselves, but for our families, for our friends, for our community. And that is a noble cause in and of itself.
Yes.
To see an opportunity, to see a gap, to see a hole, and to want to fill that for other people,
Yes.
that's very noble. So I love the ideas. I love that we are different and that you can't put us in a box.
Yes.
And that's what excites me. None of us are in a box.
And you're flexible.
And
you're nimble.
Have to be.
Yes.
Every day, every second.
Yes. I think that's awesome. I want you to tell us about how you manage self-care. Like, what does that look like for you in your business, particularly being in the healthcare space?
Self-care is self-compassion and self-love and saying, I'm not having a good day.
Okay.
And what do I need to do, to help me get through my duties as a mom, as an entrepreneur, as a business owner, as a person who's helping my clients.
Yes.
And sometimes you have to push yourself aside and do what you have to do for them. But then you have to make a constant effort to say, okay, I'm doing for others. I'm going to carve out an hour.
Yes.
Or for me, it's sitting in a dark room with no family around, with music in the background, just kind of, taking deep breaths and letting the imagery and the thoughts and everything float around and really pay attention to my body. That was something that as a bedside nurse, I didn't do. And I had a couple wake-up calls, and I've learned how to pay attention, how to step back, how to take a week off. And it doesn't feel good, because there's always something to do. It's not easy, but it's necessary, because then you come back with your battery charged. You come back ready to give everybody all that you can give.
Yes.
And you're smiling and you're happy and you're not grumpy and you're like, yes, I'm doing this because I love to do this. So self-care is listening to your spirit, your body, and your mind, and paying attention when all of those things are not in harmony. And saying, okay, what is it that I need? Okay, so my spirit, I need to seek out spiritual love, guidance, and however you do that. My mind, okay, so for me, it's a float therapy, or it's sitting in that dark room listening to music, or it's saying to my family, I will see you all because I have to go for a walk on the Schuylkill River Trail, and yes, I have 50 million things to do, but I will be back in 2 hours. Don't call me. So whatever that is for you,
I can empathize with that.
Figuring that out and being okay with doing that. Because if you're not taking care of yourself, you can't take care of anybody else.
Would you say that this self-care regimen that you've crafted for yourself, that you pass that on to your clients as well as a form of preventative healthcare measures?
Definitely. For one client that I helped find insurance, one of the conversations was, what are you doing to step back? What does your schedule look like? How are you making time for yourself? Are you carving that time out for yourself? Are you saying to your family, hey, I need 5 minutes? Because I think as people, we don't want to make anybody feel like we don't care about them, and we don't want to feel selfish. But and having that conversation, it's not selfish to say that I need a day. It's not selfish to say I'm going to go do this thing. It's actually very loving and compassionate, and we need to be more compassionate to ourselves, because we would do that for somebody else. And so those are the conversations that I have. It's okay. It's all right. And what do you think that looks like? What do you want to do with that time? Look at your schedule and see if you can carve a little time out for yourself. So
put your face mask on first.
Yes.
For yourself.
Yes.
I want you to tell us what success looks like to you. Kyana Brathwaite, like, what is success for your business, for you as an entrepreneur, for you as a woman doing amazing things in this world? Like, what does success mean to you?
That's been something that I've kind of grappled with. What does success mean? Because society kind of tries to tell us what success looks like. And is that a $50 million company, in revenue? Is that the kids in boarding school? Is that trips on a yacht? And for me, I'm quite practical. It's being able to take time off and be present with my family.
Yes.
To be present with my clients and to be present in my business, but to constantly grow, because I've realized on this journey what I don't know
Yes.
And I've really started to hone in on my leadership skills.
Yes.
And really saying, okay, success for me is to be able to pull the best out of everybody that's around me. Because my team isn't just the people who work for me, the people who work with me. My team is my family. My team is my friends. And my team is that next person that I meet, because I need you to be at your best for me to be at my best, for all of us to do well. So success is seeing that light in other people, bringing that light out and helping it shine in whatever way, shape, or form that looks like. That's what success is.
I am speechless. I think that is the best way to end today's segment. Being the light, being the bridge, being the translator, being the part of the whole with your clients, with the community, with your family, with these new entrepreneurs that you're going to begin to work with, and help them to understand how to access healthcare in a way that's not just, another box that they check, but it's a part of life. It's an integral part of life that if you're not caring for yourself, if you're not caring for your team and your family, then the business ceases to exist, really.
Yeah.
And so I want to thank you so much for coming on the show today, Kyana, because what you've brought to our listening audience is powerful. And where can we find out more information about your services? How can we access you?
And thank you for having me. I really appreciate this opportunity to share.
My pleasure.
So there's a couple ways. You can definitely give me a call. I'm one of those people that loves to talk. So I have a phone number, 215-695-6540. I do have a website. It's kbcalls, kbcalls.wixsite.com/homepage.
Yes.
There's a lot to it. And then my email address is Kyana B, so Kyana B as in boy, at kbcalls.com.
Thank you so much, Kyana.
Thank you.
My name is Tiffany Spraggins-Payne, and I'm your host of Zigzag. Today, my guest was Kyana Brathwaite. She is the CEO and founder of KB Call's Caring Advocacy and Liaison Services, and their tagline is empowering people to make informed healthcare decisions. For more information about Zigzag or any of our other programming on the Grit Live, you can reach us at www.theenterprisecenter.com. We're also on Apple Podcasts, YouTube, and I'm signing off.
Hello everyone, I'm Ryan Martin, the production consultant for The Grit Live. If you enjoyed this episode of Zigzag, please share it with the world. If you have any feedback or would like to be featured on this program, please email us at thegritlive@gmail.com. Join us Thursday, May 3rd at Eats for Equity, a special fundraiser showcasing the Center for Culinary Enterprises and some of the businesses that you've heard on the Grit Live's programming. For more details, visit e4e2018.eventbrite.com. That's e2018.eventbrite.com. Thank you for listening.